and thank you for the kind invitation to attend this Chemistry World Conference. The title of my presentation is Design and Synthesis of Nitrogen Heterocycles with Antileishmanial Activity, from Natural Products Inspiration to 2D, 3D QSAR models. Leishmaniasis is caused by protozoan parasites, which are transmitted by the bite of infected female phlebotomine sandflies. There are three main forms of leishmaniasis: visceral, the most serious form; cutaneous, the most common, usually causing skin ulcers; and mucocutaneous, affecting mouth, nose, and throat. Visceral leishmaniasis, also known as QSAR, is fatal if left untreated in over 90–50% of cases, and it has mortality potential. Over 19% of mucocutaneous leishmaniasis cases occur in Bolivia, Brazil, Ethiopia, and Peru. The disease affects some of the world's poorest people and is associated with malnutrition, population displacement, poor housing, a weak immune system, and lack of financial resources. An estimated 700,000 to 1 million new cases occur annually. Only a small fraction of those infected by parasites causing leishmaniasis will eventually develop the disease. Leishmaniasis is found in about 88 countries. Approximately 350 million people live in these areas. In the Americas, leishmaniasis is endemic in most of the countries, including Argentina, with the exception of Canada, Chile, and Uruguay, in which no autochthonous cases were reported. Leishmaniasis is caused by obligated intracellular protozoal of the genus Leishmania. Human infection is caused by about 21 of 30 species that infect mammals. Leishmania donovani complex with 3 species, Leishmania mexicana complex with 3 main species, Mexicana amazonensis and venezuelensis, Leishmania tropica, L. Mayer, L. ethiopica, and the subgenus Viania with 4 main species, Leishmania viana brasiliensis, guayanensis, panamensis, and peruviana. They are morphologically indistinguishable, but they can be differentiated by enzyme analysis, molecular methods, or monoclonal antibodies. The life cycle of the parasite is divided into human and sandfly stages. At the beginning, promasticotes that reach the puncture wound are phagocytized by macrophages. At the beginning, the sandfly takes a black meal so that ingests promasticote stage into the skin. Then promasticotes are phagocytized by macrophages or other type of mononuclear phagocytic cells. The promastigotes transform into amastigotes, another effective species. Amastigotes multiply in cells of various tissues and infect other cells. Sandfly takes a black meal, so ingests macrophages infected with amastigotes. And the sandflies have the ingestion of parasitized cell. Then amastigotes transform into promastigote stage in the gut, and then divide in the gut and migrate to proboscis to continue one more time the cycle. What about the treatment? A limited number of drugs are available for the treatment, and the recommended first-line therapies for leishmaniasis include pentavalent antileishmanial compounds such as sodium stibogluconate pentostam and meglumine antimoniate. Both are effective, but they're also with toxic side effects. One parenteral agent is amphotericin B, recently presented as a liposomal form, and is administered by intravenous infusion. This drug was approved by the FDA for the treatment of visceral leishmaniasis. 10 years ago, FDA approved the oral agent miltefosine for treatment of cutaneous, mucocutaneous, and visceral leishmaniasis caused by particular leishmania species. And some medications are commercially available in the United States, but the FDA approved indications do not include leishmaniasis. Their use are anti-mycotic compounds. There are these azole compounds such as miconazole and ketoconazole. So, the oral administration has the advantage of reducing difficulties that are present in areas where the disease is endemic and health facilities are lacking. So there's an urgent need to find new drugs for this disease. The quinoline scaffold, first discovered in natural substance, is present in a wide variety of biological active compounds of both synthetic and natural products. The different biological activities are, for example, as anti-cancer, antimicrobial, antiviral, antifungal, anti-asthmatic, and cardiovascular compounds. From quinoline, it is well known the case of quinine, an alkaloid extracted from quinina bark from a medicinal, which is a medicinal plant from South America. And quinine was the first isolated natural compound to be used in the treatment of malaria. Many quinine derivatives were subsequent synthesized, and the leading case is chloroquine. This compound which rapidly became the first-line treatment for this disease. More recently, attention has been devoted to the possibility of repurposing anti-malarial drugs for the treatment of leishmaniasis, as we can see in this compound, this analog to chloroquine compound. Because chloroquine and all the derivatives have always attracted chemists and biologists because of their diversity of chemical and pharmacological properties, as we have shown here. More than 30 years ago, the group of Alain Fournet, a French researcher, observed that a Bolivian native group, the Quimains, used extract of Gallipea longiflora, a tree of the Rutaceae family, to treat cutaneous lesions of leishmaniasis, both as ointments and by decoctions for drinking. The extraction of compounds from Gallipea longiflora bark led to the identification of about 10 original structures with a quinoline scaffold substituted at the 2 position. In generally, most of them are called Quimains, remembering that group of native from America. For example, 2N-propylquinoline, 2-propenyl quinoline, and 2-trans-epoxypropylquinoline exhibited moderated in vitro activity on promastigotes of several Leishmania species. Another active analogs were evaluated in vivo. In this models, animals treated with 2N-propylquinoline or compound 10 showed the same reduction in lesion size as those models treated with the reference drug glucantin, administered as subcutaneous injection. Despite the highest dose of the tested compounds, no sign of toxicity was detected. And in addition, with the same dose of 2-propenyl here, compound 9, quinoline led to a 95% reduction in the parasite load. So this discovery encouraged other authors to develop carbon-2 substitute quinolines as antileishmanial agents, including our research group. At the beginning, we prepare via the microwave-assisted organic synthesis this family of 2-phenylquinolines for carboxylic acids in order to evaluate them as potential antiparasitic compounds. A family of 12 compounds was prepared in short reaction times and in moderate yields, in good yields considering this kind of Doppler reactions from substituted anilines and arylaldehydes, and also this sorry, I can't remember the name now, and this acid one, pyruvic acid. So they were, all the compounds were submitted to the World Health Organization for their antiparasitic evaluation against Plasmodium falciparum, Leishmania donovani, Trypanosoma cruzi, TB rhodesiense, and also Leishmania infantum, as well as the determination of the cytotoxicity against mammal cells. In general, the compounds showed weak activity against malaria. Only compound 4B shows some kind of inhibition, but compound 4K with 7 3-fluoromethyl group resulted active against Leishmania infantum. And resulted also non-toxic for mammalian cells. At the same time, a series of polysubstituted quinolines was prepared via microwave irradiation under acid catalyst. The Friedlander reaction was carried out in good yields and short reaction times. Furthermore, from compound 3D was prepared the piperidine derivative 4, also in good yield. Here are depicted 10 analogs compounds of polysubstituted quinolines under their starting material. All the compounds were submitted again to the World Health Organization for their antiparasitic evaluation. Regarding Plasmodium falciparum and Trypanosoma cruzi, the more active compound was the piperidine derivative 4 with these activity values. Two compounds exhibited activity against Leishmania infantum, and they are shown in the next slide. And of course, they were the driving force for the design and preparation of new derivatives. These are the two mentioned compounds. Owing to our previous findings and the reported antileishmanial activity of 4-amino 2-steryl quinolines and 2-aryl 4-quinoline as carboxylic acids that we were previously prepared, we were prompted to investigate the influence of the vinyl bridge insertion between the 2-aryl ring and the quinoline core on the antileishmanial activity. So we prepared the starting material from employing the Fitzinger reaction from isatine and ketone. Then it was subjected to Neuville-Nagel condensation reaction with several aryl aldehydes, and in good to excellent yields from 60 to 90% and short reaction times in 2 minutes were prepared this family of 18 compounds. All these products were evaluated in the University of Sao Paulo in Brazil against infective forms of Leishmania amazonensis, promastigotes, and also in intracellular amastigosis and host macrophage infection assays. This figure shows the inhibitory effect of 2-aryl vinyl for quinoline carboxylic acid derivatives on the proliferation of L. amazonensis promastigotes at a single dose of 29.3 micromolar. The reference drugs were amphotericin B and miltefosine. These two figures show the bone marrow macrophage containing intracellular amastigotes and treated with the more relevant compounds 1 to 6 and 14. In figure A, we can see the number of intracellular parasites per 100 infected BMS. In figure B, it is shown the percentage of amastigotes infection. With the reference drug amphotericin. Here are shown representative images of amastigote infected bone marrow macrophage. Untreated is A, B is the control, is the reference drug amphotericin B, and the following images correspond to the more active compounds. Compounds 4 and 6 possessing 2-chloro or 4-chloro atom, respectively, were considered the most promising antileishmanial agents due to the parasite killing effect in intracellular forms inside infected macrophages. In this table, several molecular properties of the active products 1 to 6 and 14 were calculated from mole expiration server. And they, according to the rule of 5 of Lipinski, and only 2 compounds differs from these rules because their log P are higher than 5. Here is the visualization of the descriptor molecular lipophilicity potential MLP for representative 3D molecular structures of the more active compounds. Compounds 4 and 5 were the more active ones, but the other ones also possess activity. These 3D molecular structures were also obtained from mole expiration server. We can suggest that a possible target for these compounds is the flavoenzyme dehydroorotated dehydrogenase because it's a validate target for the inhibitory effect against Leishmania species. And it was demonstrated that the vinyl group between the quinoline moiety and the 2-aryl ring was a good strategy to improve the activity of the former compounds. More recently, we present this part of our work, and we have developed two computational models based on three-dimensional quantitative structure activity, 3D QSAR, using comparative molecular similarity index analysis, QSAR. In addition, also 2D QSAR studies was developed based on quantum descriptors. Thus, a series of quinoline chalcones hybrids was designed and synthesized, and the products were further subjected to evaluation for their as inhibitors of Leishmania species in order to validate the model. The term hybrid drug generally refers to the combination of two or more biologically active molecules or two pharmacophorous groups of different compounds in only one molecule. We have on one hand, we have our previously mentioned quinoline derivatives, and especially the two sterols or the polysubstituted with this quinoline ring. And on the other hand, the chalcone and alpha, beta, unsaturated ketone is also a pharmacophoric group, which can be found in natural products. It has been demonstrated that certain chalcones can inhibit the growth of Leishmania species. For example, the natural compound licochalcone 2,1 shows inhibition activity on Leishmania infantum cerasi, which is associated to visceral leishmaniasis. And compound 2 is a synthetic chalcone derivative, and it has inhibition activity on several Leishmanian strains. So, after compiling the dataset of the inhibitory activity of 37 chalcone derivatives against Leishmania amazonensis, a 3D QSAR model was constructed using QSAR. This strategy allows the rational direction of the chemical modifications and synthetic efforts. For external validation, a group of 5 chalcones compounds were excluded from the training set and they were assigned to the test set. In this figure, on this image, QSAR steric AB and QSAR hydrogen bonding acceptor CT counter maps around compounds 8 left and 37 right the most active and the less active compounds of the series, respectively. Here, here it is shown the plot of experimental versus predicted PIC50 values for the training set in blue and the test set in red, and also some outlier set in green. In this slide, we can see the two principal descriptors, the lowest unoccupied molecular orbital LUMO and their square molecular orbital LUMO. A corresponds to the most active compound, 8, B from the less active compound, 37. So, finally, based on the development of the 3D QSAR model using COMSIA with steric and hydrogen bond acceptor fields, the most relevant structural information for modulating the inhibitory activity against Leishmania amazonensis is shown in this figure. Principally, in ring A, it is proposed to enlarge this ring. That's why we designed this series, the following series. So, from the two pharmacophoric cores, quinoline and chalcone, we have taken in account a summary of the QSAR and designed a family of hybrid quinoline chalcones proposed using these QSAR models. So we decided, as explained before, a new series of hybrid quinoline chalcone derivatives. To prepare the quinoline chalcone hybrid, the starting material, 3-acetyl-quinoline 3, was prepared from the Friedlander reaction from these two amino benzophenol and acetyl ketone. Then, from this compound 3, it was reacted with different aldehydes and subjected to the Claisen-Schmidt reaction under alkaline medium of sodium hydroxide in ethanol to obtain these final products 1 to 12 in good yields. So in this table, we can see the different PIC50 values, the experimental ones, and the and also a macromolar and the PIC50 values, and they obtained from the different models. And the physicochemical and pharmacokinetics properties of the most active compounds on Leishmania amazonensis are depicted in this table. The list of these descriptors was obtained, these numbers were obtained using the online Swiss ATME platform. And here are shown the more active compounds. It is interesting to know that in the aryl group, these compounds possess halogen atoms, and this was also sorry. This kind of substitution was also found active in our previous work. So, Entschuldigung, excuse me. Overall, these findings demonstrate that these 2D and 3D QSAR models possess strong predictive power and could serve as a rational basis for the design of a new generation of Leishmania amazonensis growth inhibitors based on this quinoline-chalcone pharmacophore. I would like to thank the organizing committee of this conference, as well as our colleagues of University of Sao Paulo, Dr. Mauro Cortes, and University of La Plata, Argentina, Universidad Central from Chile, and my colleague Gisela Musia from our University of Buenos Aires. Thank you very much.